Hi, welcome to a new video at Nuarch by Dr. Sal. So the topic of this video is bad breath. So I want to answer a few questions about it. And question number one, what causes bad breath? So I'm a dentist, obviously, so when somebody asks me this question, I think of teeth and gums. So bad gums and bad teeth, they retain bacteria, and bacteria causes smell. So these are the types of things that can cause bad breath when somebody doesn't care for their mouth really well. So it could be bacteria that stay inside the mouth around teeth and the gums. So that would be a main cause of bad breath. And there's also, people that have issues with their airway or back of their throat, and if it's not in a healthy situation, that's also an area where bacteria can settle, like the back of the throat, and cause bad breath. So that's another sulfur-producing bacteria is the cause of bad breath. Here's a question about it. How can I tell if I have bad breath? Well, maybe you can't tell, but other people could. If one notices that people are not around them or coming very close or like turning their head the other way, that could be a sign. It could just be a garlicky food that one's had, but oftentimes the types of bacteria that's responsible for bad breath has a distinct smell, and it's very unpleasant. So it's definitely unhealthy. It's not socially acceptable. So it's something that needs to be dealt with for people. So here's another question: what are some common causes of bad breath? The first cause would probably be teeth or gum related. If there's anything unhealthy about things, if there's dental work that can't be cleaned easily, dentures that are not cleaned properly, periodontal disease, gum disease, these are all causes for developing bad breath. And so these are the main causes of it. Here's another question: are there any home remedies or self-care steps I can take to improve my bad breath? Of course, certainly. I would say first step would be to visit your dentist or the hygienist. Find out if there's any dental related issues about the bad breath. Are the gums healthy? Are the teeth healthy? Is there any dental work that needs to be updated? So since these are the main causes of bad breath, I think this should first be checked out. And if those all check healthy and good, then other things could be looked at. I'm familiar with certain types of food is really good for breath, like apples. Apples are great. They're very, very cleansing for teeth and gums. Also watermelon. That's another food that I really love, and my mouth really feels fresh after I have those. So those things would be my recommendation. Well, are there any foods or drinks that contribute to bad breath? Well, certainly, there's some, we all know garlic and onion. I think there's certain types of food that just don't smell very good, or they stay with you for a while. But if the problem is deeper than that, it's just not food, one might want to consult with an ENT doctor if the reason is not really teeth or gum related. So they would be able to check things out for you to see if there's anything further back in the mouth that might be a cause of this. So here's the last question: when should you consider seeing a dentist or healthcare professional for bad breath? I guess that bad breath is not something healthy, so it shouldn't be ignored, and the reasons for it should be understood. If it's teeth and gums related, well, luckily that could be helped with. If it has to do with like further down the mouth, like the throat area, an ENT doctor can be helpful to it, or perhaps somebody who specializes in stomach issues, they could be helpful with understanding what the source of it would be. So thank you for watching the video. I appreciate your input, and see you.